I'm Jo McIntosh. I'm the team leader for the Complex Care Coordination Service at Armidale Hospital. So our target patients are patients who are at risk of representation. That includes patients that are requiring multidisciplinary input and often outside of the standard model of care. We also look at patients who are frequent presenters to WA hospitals, and that's 3 or more ED presentations or hospital admissions in the last 6 months. We also look at patients who have chronic diseases, specifically COPD, heart failure and type 1, type 2 diabetics. They're the top DRGs in Armidale Hospital for frequent presentations and often needing lots of extra support for their self-management. Our overall aim is to improve the patient's experience by providing patient-centred care, supporting the patient, the carer and their families through the transition from the hospital into the community and linking them into community services that will be the best person for them. So it's putting the right person at the right place with the right service at the right time with the right provider. We continuously strive to improve our collaborations with community services. So we've linked in with Silver Chain Respiratory and a residential care line. They're services that actually come into the hospital and come and see active patients, indicate patients that would be appropriate for their service, and they also highlight their service to other staff members. We're also collaborating with community services to do different trials. So we're working with the GPs and the Ports service in order to increase the number of referrals and to reduce the gap between the services delays to actually get the referrals to them. We're also working with Mentagram and Richmond Wellbeing to try and support patients in their self-management after a post-acute hospital stay, so that they're supported in knowing what to do with their chronic disease until they can be seen from pulmonary rehab or cardiac rehab as an outpatient. So 3 years ago it was ascertained from different literature to say that the number of population is 70% in Australia had chronic diseases that were going to keep re-presenting frequently, and that they were expecting that 80% would go up to in 2020. So it was an ever-increasing population, and as our population gets older, we're also going to have more complex care needs. This is indicating that people are going to keep re-presenting, they're going to have longer length of stay, there's going to be more complex needs and needing that extra integration and coordination with all the different services in primary health care. So we move towards a service that we're looking at the patient holistically, providing them the extra support so that they know about their diseases, linking them into the right services, and looking at them out as an outpatient as well. Getting them in the right services, but we're also linking in and making sure that they're okay. This is also promoting the reduction of length of stay. It's decreasing the amount of representations, and most importantly, it's a better experience for the patient. The Complex Care Coordination Service was nominated and a finalist at the WA Health Excellence Award in 2018 for developing sustainable solutions for out-of-hospital healthcare. The service was also received certificates of commendation in both 2017 and 2018 for outstanding contribution to allied health. One of our team members was also nominated for the Health Professional Award and Compassionate Care Award at the Health Consumer Council Excellence Awards in 2019. The service continually strives to provide excellent evidence-based, patient-centred healthcare that collaborates with primary healthcare services so that the patient receives the best healthcare service available and the local community services are not only accessed but incorporated into the delivery of everyday healthcare. Excellence means that we have gone above and beyond to provide the best possible healthcare service that we can to each and every patient. Nobody falls in the gap, and that we have strived to achieve the best that we can for them. Our team is really passionate about what we do, and we're really passionate about what we can achieve with our patients. It's having that job satisfaction that we've made a difference to a patient and their lives that makes us come back the next day and want to achieve more and improve someone else's life as well.